A very good afternoon and warm welcome to all our viewers. On behalf of Human Biological Institute and Fearless Against Rabies. Fearless Against Rabies is yet another is an initiative by Human Biological Institute to educate about rabies and reduce the incidence of disease. It is my pleasure to take this opportunity and share about Human Biological Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. One Health Initiative talks about the optimum health of animals, people, and the environment. Indian Immunological Limited was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunologicals Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. The facility is one of its kind in India to have rolled out first vero cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines and currently we are the major player in human vaccines. We are the leaders in anti-rabies vaccine segment and are present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Genome Valley. Human Biological Institute has forayed into the market of clinical proven wellness products and infertility ranges of hormones. Well, coming to our vision, mission, and values. Our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovation and improvements to meet our customers' need. As a company, we are the kind of company who will definitely look after taking care of the environment as well. We proudly bring before you the Green Initiative. As we have launched our flagship brand, anti-rabies vaccine Abhairab, and with this, we have taken significant step to reduce the plastic burden by 160 ton per annum. As a company, we don't just manufacture and market products, but Human Biological Institute has done a lot in corporate social responsibility and has taken up various projects. One such project is the adoption of government school. Indian Immunological Limited has adopted the government schools in the vicinity of its Karkapatla facility in Hyderabad. Another program is Gift Milk Program in coordination with National Dairy Development Board. We are giving additional nutritional supplements to over 1,600 school-going children of Telangana and Tamil Nadu. We have also facilitated the setup of oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. You can visit us on our website www.indieimmune.com. You can also call us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. So once again, I welcome all our viewers who have joined us live today on the Fearless Against Rabies platform. Well, in today's session, we are going to learn about the topic tetanus, a vaccine preventable disease. As we know, vaccination is most effective way to prevent tetanus and it is recommended for all individuals, especially those who work in the occupation that may expose them to soil or other potentially contaminated materials. To enlighten us about this topic, we have a very special guest with us today. Please welcome Dr. Ravinder K. Gupta. Dr. Ravinder K. Gupta is highly esteemed medical professional with expertise in the field of pediatrics. He currently holds the position of professor and head of the department at SCOMS Medical College, Patra. where he plays an instrumental role in educating and training the next generation of healthcare practitioners. With a wealth of experience and knowledge in pediatric medicine, Dr. Ravindra K. Gupta is dedicated to providing the highest standard of care to his patients and making a positive impact on the field of medicine. A very warm welcome,
Hello,
very warm welcome, Dr. Ravindra K. Gupta on Fairness Against Rabies platform.
thank you, Deepali, for nice introduction.
Thank you, sir. Doctor, while we start our discussion for today, I would request you to please let our viewers know about that what is tetanus.
Everybody knows about tetanus. Tetanus used to be one of the dreadful conditions, though it was a vaccine preventable condition. In Hindi, we call it as a chanani, and everybody is afraid whenever somebody gets some injury. कि ये चांदनी हो जाएगी हमें बच्चे को या बड़े को चांदनी हो जाएगी कोई भी चोट लगे बी इट ए थॉर्न or be it a burn injury, be it a electric burns, be it any accident, be it a crash injury, any type of injury, the person are very much afraid. Specifically, I don't know about the culture. People are very much afraid of, especially in rainy season. They are very much afraid of कि भाई यार बारिश हो रही है बादल गरज रहे हैं इसको तो टीका लगाना पड़ेगा चांदनी हो जाएगी. This is what are the myths in the many but frankly speaking, tetanus is a bacterial condition caused by the organism called as Clostridia tetani. The word is tetani, Clostridia tetani, is from where the tetanus comes. This is a bacteria basically. What happens? This toxin, there are liberate. The bacteria liberates the toxin, and this toxin the affects the nerves and brain. Specifically, it affects the brain. That is called. That's why we call it as a cephalic tetanus. Then it affects the brain nerves, which affect the muscles because our brain is situated like that it conducts many activities. Brain commands gives command to various organs of the body. Specifically, the nerves which affect the muscles are being affected. These toxins cause damage to these nerves, which are responsible for muscle. As a result, what happens? There is a muscular spasm. Body gets stretched. Sometimes the earliest symptom is lockjaw. You
Yes.
cannot open your mouth. This is the earliest one of the earliest symptoms. A normal person was there. Suddenly he finds that he is not able to open the mouth. So many a time he may get confused because he has some injury or he may have some earache. He may have toothache. That's why he is not able to open the mouth. But suddenly he gets stretching like spasm of the neck. तो मुझे कहते हैं ना बॉडी गेट स्ट्रेच्ड
Yes.
समटाइम देयर इज स्पेशली वी सी उल्टा हो जाता है तो common symptoms that they are having tetanus. So tetanus is basically a dreadful condition. But frankly speaking, nowadays, because of this, I think immunization, this condition is declining now day by day.
Okay, doctor. As you said about the tetanus, and you also mentioned few of the symptoms, but can you please elaborate what kind of symptoms or there are complications of tetanus?
Yeah, this was just a brief what I have told you, but there can be varied. There is a varied list. The symptoms can be there. Specifically, the first symptom is again I will tell you there is difficulty in opening or swallowing.
Okay.
Even sometimes you cannot swallow properly, so there will be jaw cramping. There can be sudden spasm of muscles. You can have a stretch. There can be muscle stiffness all over the body. You suddenly find that your muscle body is stiff. It was normal, and after a few days, you are having. There may be dysphagia. Even if I am not able to speak, dysphagia, difficulty in swallowing, difficulty in speaking. There can be sometimes jerky movements,
Okay.
like you may have seizures, what we call as a abnormal movements, or sometimes you may call as a convulsions. Sometimes they are the, because there is a varied list. So they can be seizure. Sometimes they can be headache. Sometimes there can be fever, sweating. If we go further, the blood pressure rises, or even heart rate increases. So there is a arching. Arching, I told you there is a arching, opposite to non position. Like this, what this is normal, this is a reverse. Or we can say convexity, what happens, the body gets stretched, and like sometimes you do some yoga asana, like this thing, and your body suddenly becomes, and it is very difficult to treat at that time. So, and frankly, again, one I must tell to the viewers that this injury doesn't, आज चोट लगी है तो कल tetanus हो जाएगा. This is not there.
Okay.
There is called what we call as a incubation period. Incubation period means it very depends on the type of injury, the type where you got the injury. Like usually it is mentioned that it may take 3 to 21 days for after the injury to get the tetanus. Sometimes it may be even prolonged, depending upon your body immunity, depending upon your immunization status, depending upon the type of injury. So the symptoms are varied. Tetanus doesn't occur on the day of the injury. This is what I want to convey to you.
So it takes time to develop.
Yeah, it cuts time.
So, doctor, as you told about the symptoms of the tetanus, so once a patient is diagnosed that this patient has now got tetanus, so what is the treatment for the tetanus?
Yeah. Frankly, one again, I will tell you that tetanus is, there are hardly very few laboratory tests
Okay.
for tetanus. It is a clinical criteria. We give more stress. यार आपको कोई चोट तो नहीं लगी थी, recall that thing. Then the parents, yes, हमें चोट लगी थी 7 दिन पहले, 8 दिन पहले. Where was the injury? Type of injury? सर नहीं, मैं गार्डनिंग कर रहा था. I got some nail prick or thorn prick. Mostly people think that rusty nails can cause tetanus earlier. See what are the concept in the mind of the people. But I will tell you that even burn injury can cause tetanus. Even accidents. Okay, then soil, dust, manure, these spores, they are normally present. They enter the body through that cut area.
Okay.
That what happens is type of injury is there, that spores do gain entry in that cut area. With we, because sometimes there are minor cuts you can see with the only with the lens only. Even if you your shave, you have some minor cuts also. If you do with unhealthy blade, that we will discuss in when we discuss neonatal tetanus also. But normally, I'm telling you, even minor cuts can give entrance to spores of these bacteria. Then spores become bacteria. They liberate toxins, and then what I have told you earlier also, they affect these things. So there are hardly very few laboratory tests to diagnose that person has got that is for just academic purpose, not for clinical treatment. Now, once tetanus has been there, as I told you, there are very varied symptoms. Now, for arching, we give symptomatic treatment. Symptomatic, you know what is the symptomatic? If child is having headache, we give paracetamol or whatever treatment. Similarly, for seizures, we give anticonvulsant drugs.
Okay.
For some time, there can be injuries there. We treat the injury. We try to clean the wound. Try to remove that dust, and that is dependent. Then also, if there is, the problem is tetanus is that muscles get affected.
Yes.
If breathing muscles get affected, that is a problem. The cause of death because of tetanus is that our muscles which are controlling our breathing gets affected. So you cannot breathe. If you cannot breathe, you cannot survive. Then you have to put on ventilation.
Oh.
So the muscles of the breathing, if get involved, is relatively a dreadful condition. At that time, very few amenities are there to prevent from death. Or that is the only method is ventilation. So idea is to prevent our muscular involvement also.
Okay. Thank you so much, doctor, for answering this question. So then, doctor, when we say there's a tetanus toxoid, this
Yeah.
term tetanus toxoid. So, doctor, we want to know that what is tetanus toxoid?
This tetanus toxoid, as its name signifies, is a vaccine. Vaccine which prevents from tetanus. This comes in either ampule form, vial form, liquid form, which is we are giving to a person after the injury. Is tetanus toxoid. There is another term called as tetanus immunoglobulin. That is different. The tetanus immunoglobulin is different. Tetanus toxoid is different. Toxoid means this is a basically what happens. These are type of vaccine. And what are the vaccine? You know that everybody must know that vaccines are either killed form or live of the organisms. Like tetanus, I told you Clostridia tetani. It is a same organism which has been modified, which given in the body, it introduces the immunity
Okay.
against that organism. This is the normal basic concept of the any immunization. So there are two type. Some one is killed vaccine, one is a live vaccine, one is toxide vaccine. Toxide is then there is a live attenuated vaccine. So there are different types of vaccines. So this toxide is a basically a toxin which are introduced in the body, and they generate immunity. They stimulate the our immunity cells, and which helps in production of immunity. So it cannot prevent you from getting immediately from the tetanus. This should be very much clear. But I told you that incubation period is from 3 to 21 days. Doesn't matter ki if child gets injury or adult gets injury today, he forgets to get vaccine or this tetanus toxin, he can get after second day or third day even. So that can will prevent from and will help in developing the immunity, and immunity will be there from tetanus.
Thank you so much, doctor. Well, previously you told that even burns can give the, allow the tetanus to enter into the body. So,
Yeah,
what kind of other injuries might as well also allow tetanus to enter the body?
I told you that accidents, any accident, crush injuries.
Oh,
You might have seen crush injuries, even blast injuries, cracker injuries.
okay.
Cracker, specifically during celebrations like Deepavali, or if any of your team wins the match and you start bursting the crackers, you can suddenly, specifically, these anar injuries are very much common,
Yes.
and among the children. Then, similarly, any type of blast injuries, crush injuries, or even I told you to have small minor injury like pricks, be it a nail, be it a thorn of that. If you try to pluck the flowers, so you can get injury. Rose horn injury, what we call it is a. So there are numerous type of injury which can are likely can cause tetanus. Specifically, again I repeat, to those persons who has not received vaccination earlier. It doesn't matter if you many of the time you may have received tetanus toxide in your past. So there are less chances of tetanus among those people.
Thank you, doctor. As you said, there will be burn injuries, or say during the firecrackers there is an injury. So at that time, what could be the wound care management?
Yeah, you as a wound care management, you can simply wash the wound. This is a simple phenomenon. Be it a dog bite, be it any injury. The first principle is to clean the wound. The running water is one of the important and best antiseptic it is considered. If you don't have any antiseptic, simply you put your hand among running water, like just open the tap and it will remove the dirt, it will remove the dust, it will remove the organisms. This is what. So similarly, this is the first thing. Then if you go to a better center, they clean with antiseptics, and if there is a the form antiseptic ointments are to be applied, and then if there is a scab formation, you do a debridement, and then as per the type of injury, as per the surgeon sees, whatever this application of that antiseptics are being applied to prevent from injury. This is management of the injury. If we want to consider the injury, I'm not talking about tetanus. I'm talking the injury wound management. Wound management depends upon the type of wound where you have received, what type of wound it is there. Because sometimes it has been very deep wound, and you have to take the swab and you do the culture sensitivity, or you even put the antibiotics there locally also, or parentally or orally, whatever it is. So it all depends upon the type of injury.
Thank you, doctor. Well, doctor, as we there's a term called neonatal tetanus, which
Yeah,
generally occurs in very young infants and which is usually due to the umbilical infection.
yeah, yeah,
Can you please elaborate to our viewers that what is the neonatal tetanus?
yeah. This neonate, as the term neonate. What is neonate? Neonate is a baby up to 30 days. Sometimes say we, and when we teach to students, we teach up to 28 days. But for common remembrance, what we hear, less than 1 month baby is called a neonate. And if it is child is one less than 1 year, we call it as an infant. So terms are two are different terms. Infant can be neonate,
Okay.
but a neonate is not like you got my point.
Yes.
That 1 month baby is a neonate. Okay. Now what happens exactly that if many of the time people living in rural areas who are not going for antenatal checkups, the mother does not have mother have not received any text during their pregnancy, and the baby is born. Especially home deliveries are there.
Yes.
When the and you know that baby is attached with mother with some umbilical cord, and this cord has to be cut. If the deliveries are being conducted in proper institutes, they use surgical sterilized blades, and they applied antiseptics also immediately after delivery. But in rural settings, in home deliveries, in deliveries where there are no facilities available, what they do, they cut with any type of blade, knife, kitchen knife. We have seen cutting with the kitchen knife. We have seen with the shaving old discarded blade. They are cutting the thighs. Local thighs are cutting that with anything blade. They are sometimes even pulling. Sometimes even I have seen with cutting with the this teeth even. And then they apply this cow dung. But now it is very rarely seen. But still in many rural areas, very tribal areas, very rural areas, they are still doing like this thing. When there's nothing is available, they do, whatever the structure they got, even in Caesars, the unsterilized Caesars, and that umbilical cut portion is an open injury. The likely chances of spores entering the through the umbilical vein to the baby, and it results in neonatal tetanus. Now, neonatal tetanus does not develop immediately after birth. The baby may be active, the baby may be sucking properly. After 2 or 3 days, or even after 3 days, that's why I told you incubation is 3 to 7 21 days. 3 days onward, the mother complains that baby is not sucking properly. The mother is not very much active. There is a refusal of feeds, or the baby has become lethargic or irritable.
Okay.
The baby who was active 2 3 days back suddenly becomes, and what you find when we see the baby, there is suddenly stretching, there is suddenly arching. From up where the child keeps the baby, this neck stretched. Because of lockjaw, the baby is unable to suck. This is an earlier symptom. This is earlier symptom. So refusal of feed, improper sucking, lockjaw, stretching. These are, even baby may have seizures, abnormal movements. The baby becomes rigid. इतनी उसमें जान आ जाती है कि you cannot fold the legs. The mother complains, देखो क्या हो गया बच्चा, आकड़ गया means test हो गया. That's is classical neonatal tetanus.
Okay.
So there may be other conditions. There may be some technical. I won't discuss on this, but because of some jaundice, also baby becomes uh, these all symptoms. That is called as a kernicterus, or what we can the jaundice reaches the brain. That is called bilirubin encephalopathy. That is a different type of. We most of the time it becomes very difficult to differentiate from tetanus from bilirubin encephalopathy or kernicterus.
Okay.
So, if the status, so that's why we always stress, we always ask what was the status, immunization status of the mother,
Okay.
whether she had received tetanus toxin during pregnancy or not.
So then, doctor, why is vaccination important during pregnancy?
That's why that is the reason it is very important for antenatal mothers. That's why we are giving. You might be listening to the many channels that all the delivery should be conducted at a proper healthcare center, and all the antenatal mothers should visit for antenatal checkups.
Yes.
तो एंटीनेटल चेकअप के लिए वो रेगुलर जाएंगे गांव-गांव में आजकल नाव दे रहे हैं प्रे फ्री में हेल्थ सेंटर्स खुल गए हैं पीएससीज खुली हैं कम्युनिटी हेल्थ सेंटर्स खुले हैं देयर इज अ लॉट नंबर ऑफ अनाउंसमेंट्स आशा वर्कर्स आर गोइंग होम टू होम दे आर गिविंग गोइंग कोई भी देखते हैं अपनी लोकल एरिया में देयर इज सम आशा वर्कर गोज टू देयर हाउस दे फाइंड वेयर यू आर प्रेग्नेंट और नॉट प्रेग्नेंट and they give tetanus tox at 2 doses almost 4 to 6 weeks apart after 4 months. After 4 months to pregnancy के बाद even minimum time period is 4 months, and if you have missed in 4 months you can give 5 months 6 months, but that interval should be 4 to 6 weeks from first dose to second dose. So 2 doses are to be given,
Okay.
and number one, number two for vaccination, and number two delivery should be conducted at proper health places, and number three, the umbilical cord should be cut with sterilized blade or knife or scissors. This is our time. We can prevent from neonatal tetanus.
Thank you so much, doctor, for answering this question. And thank you once again, doctor, for giving us a lot of information on today's topic. Uh, Doctor, it's time to take questions from our viewers.
Yeah, please.
Just a second, doctor. There's a question from Ms. Divija. She's asking, during the injury by iron metal, within how many hours tetanus toxoid should be recommended?
I told you earlier also that the incubation period is from 3 to 21 days. Ideally, it should be as early as possible, but if you have forgotten or you have, there is not availability of the tetanus vaccine at the same day, you can go for next day also. But again, I repeat, you must every child during every person has received vaccination during childhood period, and I must tell to the audience here that if you recall your if you ask your parents that during your initial period you might have received 3 doses of DPT, diphtheria, pertussis, and T for tetanus. So you have received tetanus at the 1.5 month, 2.5 months, and 3.5 months. So many people do not know what is DPT. They only say टीका लगाया 1.5 महीना 2.5 महीना 3.5 महीना टीका लगाना. But they must know that they have already received tetanus toxide. That DPT, T stands for tetanus, and then there is a booster dose at 1.5 year or 16 to 18 months. You give DPT booster. So you are giving up to 1.5 years. Then again, one booster is given at. I am telling you about the national immunization schedule also simultaneously. That you are receiving DPT at 3 doses earlier. That is called primary series. Then you get booster at 1.5 year. Then at 5 years, DPT you again get at 5 years. That is called DPT. So again, you are getting tetanus toxide at that time also.
Correct.
So you are initially being covered from tetanus. And at the age of 10 years, again, many centers are giving TT,
Yes.
or nowadays, Government of India also recommends DT, small d and T. There is some diphtheria also. So there is a DT. They are given at 10 years. And after 10 years, every 10 year, you are supposed to get tetanus toxoid. This is I am telling about the normal immunization program.
So after 10 years as a booster dose.
Yeah, that is called a booster dose. Means any vaccine which is received after that first dose is called as a boost. It
Okay.
helps in boosting your immunity. That is a booster.
Yes.
Boost, like you might have heard about boost is secret of my energy.
Yeah.
One couple they used to tell about that one of the products. But similarly, what is the boost? Boost which has immunity inside your body, but another vaccine, another dose will boost your memory cells. That memory cells are what they are in the which produce immunity. So they will again become activated. So that's why even WHO has told us that this tetanus is almost gone now. But certain belts or pockets where people are still not vaccinated, there are likely chances of tetanus toxoid. That's this is why important is a vaccine preventable condition. So why not to go for tetanus toxoid when it is a preventable?
Thank you, doctor. There's another question is, can tetanus be spread from person to person, and what precautions should be taken to prevent transmission?
This is a very good question because many of the people are they are afraid of it, but this is not a this is not communicated from one person to another person. This should be very clear. But still, we want to isolate that patient from Texas because that patient gets disturbed with even light. That patient gets problem with tetanus. So tetanus again, it is a varied form. Which type of tetanus patient has, which stage of that patient has suffering from tetanus. But it is not contagious. Don't worry.
Thank you, doctor. Uh, what are the potential side effects of tetanus vaccine, and how common are they?
Yeah, like any other vaccine, this you know that pain is important. Where you are injecting, you may have heaviness in the upper arm, or in children we were given to vascular lateralis, the anterior lateral side of thigh. Um, that one prick pain, sometime mild means malaise, body aches can be there, or very rarely if you have already some hypersensitivity reaction earlier, you may that we don't know who are people who can have hypersensitivity. That is just a theoretical risk. But the pain at local site, slight heaviness, and sometime mild fever can be there because of this vaccine. But one of the safest vaccine I can say.
Oh, thank you, doctor. There's another question, that is it possible to contract tetanus even if you have received the vaccine? And what should you do if you suspect you have been exposed to the bacteria?
If you suspect what happens,
I'm repeating the question, doctor. Is it possible
yeah.
to contract tetanus even if you have received the vaccine? And what should you do if you suspect you have been exposed to the bacteria?
Okay. Again depends upon your immunization status. That's why if the person has not received booster, or if he doesn't recall when he last received it, there likely chance. Another one, what is about the immune? Because everybody has different immune status. Like let us talk of COVID. COVID was there. Every person did not get COVID. It was all your immunity. Whose immunity was less, they got COVID infection. But similarly, there is any bacteria, any viral condition. It all depends upon your immunological status, how much you strong from inside you are. So you can there are likely theoretically there are chances if you have does not despite vaccination which is very long back uh, or that vaccine was not effective. It can be there. Some expired vaccine has been sometimes there can be theoretically I can tell you that he might have received there are chances you may have tetanus, but it will be again a milder form, not be very severe form. Number two, if you get tetanus of different type severe form, Then I again tell you that you can prevent it by symptomatic treatment. You can do. So symptomatic treatment is depending upon what type of you. If you are having a headache or fever or sweating, you have to manage accordingly. If you are having seizures, you have to give anticonvulsants depending upon the situation. So there is a management is purely symptomatic. That's why.
Thank you, doctor, for answering the question. There's another question. How does tetanus toxoid differ from tetanus immunoglobulin? And when is tetanus immunoglobulin used?
Yeah. Tetanus toxide. Normally, what happens when I told you that when that we give injection,
Yes.
it does not produce immunity immediately. It takes certain latent period to develop immunity against tetanus. While tetanus immunoglobulin give immunity immediately. So that's why whenever a person does not recall or remember his or her immunization status, and we suspect that there is likely chance that child may or adult may get tetanus, we give tetanus immunoglobulin because it immediately acts. Immunoglobulin immediately binds with that organism and destroys that organism. But I must tell you that immunoglobulins are relatively costlier than the tetanus toxoid. So first thing is you give immunoglobulin immediately, and later on you can give tetanus toxoid. So and the effect of immunoglobulin is short term, immediately, immediately and short term, and the long lasting effect will be of tetanus toxoid. So the things should be very much clear. Immunoglobulin act immediately; they immediately bind with that organism which has entered the body and destroys that organism. And tetanus toxide they start producing like slowly after for, depending upon the how much period it may last for. Like I told you that after every 10 years you can give boosters.
Thank you, doctor. There's a last question. Can the tetanus vaccine be given at the same time as other vaccines? And are there any special consideration for administrating the vaccine to adults or individuals with certain medical conditions?
Again, a very good question. I told you that's why I told you that if you remember DPT,
Yes.
it means you have already so you will not give along with DPT dioxide again. And if other vaccines are given, like for example, you want to give hepatitis B isolated, and suddenly the patient or the person gets injury also, simultaneously you can give hepatitis B on one limb or and tetanus toxin on other limb. So it can be given. There is no contraindication. Once you will be clear. But if you give a DPT in primary series to children, there's already tetanus toxin is given. So there is no need of giving tetanus toxin along with them thing. One like similarly, if you want to give chickenpox vaccine, if you want to give rabies vaccine, so you can simultaneously we are giving tetanus toxoid as well as rabies vaccine on day one. You so simultaneously it can be given. And and the second question was medical
Yes.
conditions. Again, it is one of the safest vaccine. Many live vaccine cannot be given to person who are having immunogenic problems like CA patients, the patients who are on anti-cancer drugs, the patients who are have undergone transplants.
Okay.
We cannot give live vaccines. We similarly patients who have was on long-term steroids. We not give these live vaccines. But since this is a tetanus toxide, already toxide means least dangerous. We can give it with any medical conditions.
Thank you so much for answering the questions of the audience, doctor. Well, doctor, is there any important information about the tetanus that you would like to communicate to the audience before we conclude?
Yeah. Number one is this is one of the most preventable condition. Number two, do not be afraid of tetanus. You will not get tetanus even from any injury. Number three, do please clean the wound immediately if you are having that injury. and consult a nearby health facility for this wound management. Number four, get tetanus toxide if your status is not clear. Immunization status is not clear. If you have a proper clear cut immunization status, you should not be worried about that. You should not get, like many people, they be definitely what we ask. Even in case of dog bite, for example, I must tell you, dog bite is also causing tetanus, but can cause. When we ask status from the parents, भाई आपके ने बच्चे ने क्या डीपीटी का बूस्टर डोज कब लिया था? सर हमने अभी 5 years पे डीपीटी बूस्टर लिया है. We do not give tetanus toxin. We only give rabies vaccine. But if we ask, अरे अभी तक लगाया नहीं था, लगाना था सर, वो टाइम नहीं मिल रहा था, आज हमारी डेट नहीं थी, तो फिर हम in that situation we will likely to give tetanus toxide to along with rabies vaccine also. But I'm just citing the example.
Correct.
So you must always ask the immunization status, and doesn't mean कि आज वैक्सीन लगाया है, एक महीने बाद फिर चोट लग गई, फिर हम इंजेक्शन लगाने चलेंगे. नो, there is no need of going for that tetanus toxin, because if you receive vaccine, I told you, 10 years, 10 years you are safe from one dose to another in adulthood, right? So that is what I want to convey to. Do not get panic, any injury, you go for tetanus toxin. No.
Thank you, Doctor, for sharing important information with viewers. Thank you once again, Doctor. It was a wonderful session. We wholeheartedly thank you, Doctor, on behalf of my team as well as the Human Biological Institute for sparing your valuable time with us. And I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. You can follow us on Instagram, Facebook, LinkedIn, and Twitter to get more updates on live talks with experts doctor across the nation. With that, I wish everyone a very good afternoon. Thank you, doctor.
Thank
Thank you.
you. Bye bye.